Security Committee. She's been watching all of this very closely. Congressman, let's discuss this Congressional Budget Office estimate right now, this report, and let's get to the part that the White House likes, that it would reduce federal deficits by $337 billion over the next 10 years. That's a huge savings.
Well, there's no question about it, and it's not a surprise that they would want to focus on that. What I find so interesting is that you had Tom Price focusing on the number of uninsured rising for over the next year to 14 million and saying that could not be right. It's just an impossible reality. And then you had Mick Mulvaney talking about how great it is that the premiums are going to go down. You can't have it both ways. You can't say that the CBO report is accurate when it's something good for us and bad when it's not. And look, the CBO is only able to look at what they're given. And you heard Tom Price say there that, well, we're still working on the regulations, and they didn't take the regulations into account, and that's because they didn't see them. So, look, I think it's interesting that they can act, that they're a little shocked. I think over the past couple of days, you've heard a lot of Republicans coming out and saying, well, you know, the CBO report really isn't that accurate. You can't really rely on it. That's not really what they're meant to do, is to weigh in on things like that. And yet that's exactly what they're meant to do. And they're shining a light on the Republican plan, and I hope people are paying attention.
The new Republican plan would leave more people uninsured, according to this Congressional Budget Office report, a reduction of, they say, 24 million insured people by the year 2026. So from your perspective, and you're a Democrat, you oppose the Republican plan. What could that mean?
Well, first of all, it's an assault on seniors. It increases costs for seniors, decreases costs for younger people, when it should be the opposite. Your health care costs grow and your health care needs grow as you grow. So that's number one. It's an assault on women because it defunds Planned Parenthood. And you have more women on Medicare and Medicaid, and so it's going to affect them. It decimates Medicaid. That's where the savings comes from, but it's at the cost of giving people the health services that they need. And specifically, if you look at one of the biggest health crises we're facing here all across this country, with the opioid addiction that we have in every state across this country, it's going to take away care from people who are suffering from the disease of drug addiction. So it's just going to be devastating all across the board.
Let me read to you what then President-elect Trump told the Washington Post this past January, just days before the inauguration. We're going to have insurance for everybody. There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with us. People covered under the law can expect to have great health care. It will be in a much simplified form, much less expensive, and much better. Do you think this plan comes close to delivering on those promises by the president?
Not even close. And I think that you're going to see Donald Trump trying to walk back those statements 6 months from now, a year from now, if this is able to pass. And, you know, he was so critical of President Obama when President Obama made this statement that if you like your doctor, you can keep your doctor. And yet he's doing the same thing. So really, what are we talking about here? What we really need is straight talk from people in government. People stop using politics. You know, look, I consider myself a logical person. This plan does not make logical sense. I'm not an ideologue, and I think most of the people who came up with this plan are ideologues who see an opportunity now to basically say survival of the fittest. If you have money, you're going to be able to get access to quality health care, and if you don't, you're out of luck.
Do you see this Republican plan as the Ryan plan or the Trump plan?
There's no question that Paul Ryan has been a much more outspoken voice when it comes to health care reform. He's very wonky when it comes to that. I don't think anyone could use the word wonk together with President Trump. So I would say that most of the specifics here are probably Paul Ryan, and it's going to be up to him to get it through the House. But, you know, look, Republicans are facing the terrible choice in the House of having to vote for a bill possibly that they know will never pass in the Senate and can be used like a noose around their neck in 2018. So they've got some problems up ahead.
Congressman, I want you to stay with us. We're also standing by. We just heard that Nancy Pelosi, Chuck Schumer, the Democratic leaders in the House, and